Yeah, am I audible to you all? Am I audible to you? Sir, am I audible to you?
Yes, ma'am.
Yeah, can you see me?
Yes, sir.
Okay. Then what about, can you see my slide? Can you see my slide, please? Can somebody can respond?
Yes, sir.
Okay, thank you. We'll wait for one more 5 minutes because of I'd start my class in between 4 to 6, but number of people appeared is only 2 people, 2 students. Let us wait for one more 5 minutes, then I will start around 4:15. Okay?
Okay, sir.
Okay. Somebody can tell me how many students are attending daily, if you don't mind. Somebody can tell me. Generally, how many students are attending the class? Ravin Kumarji?
Sir, this is also my first class.
Oh, you are attending first class. Okay. Or BSR, can you please respond? BSR. Somebody is there,
Yeah.
BSR.
Yes,
How
sir. I
many
am
students are
VSR.
attending daily? How many are attending daily? Generally, how many
Sir, I
students
am
are
V.
attending?
I am VSR, sir. Bhupendra Singh Rathore. This is my first class.
You're also attending first time. Ravi Kumarji and BSR both are attending first time only. I don't know whether the students are attending the class or not is the main thing. Okay, we wait for one more 5 10 minutes. Then I will start my class, please. Okay.
Okay,
Myself,
sir.
actually, myself, J. Chandrababu, I will give my introduction about me. I don't know, somebody will come from Ignore Regional Center, Bhubaneswar or not, but I will have introduction about myself afterwards. If nobody is going to introduce me. But anyhow, we start class around 4:15. I'll wait for one more 5 minutes because there are only 2 students.
Okay, sir.
Let me wait for 5 10 minutes. Then I will start the class. Okay, please.
Okay, sir.
Yeah, now we have waited adequate time, whether students will attend or not. I cannot wait like this. Myself, J. Chandrababu, presently I am working as a region director. Am I audible to you all?
Yes, sir.
Okay. I'm working as a region director, Central Project Control Board, for the Bangalore office. Earlier, I have dealt the various subjects hazard-based management. I was dealt issues like hazardous waste management activities, followed by the hospital waste management, uh, as well as the water quality management when I worked in CPCB Delhi office. I worked in CPCB Delhi, Central Project Control Board Delhi office during the year, uh, during the year, during the year 2000 to 2000, uh, 2000 to 2022. I'm sorry, sir. I just started class. Sir. Will you come? Okay. Shall I start? Okay. Okay. Therefore, I worked in the field of hazard-based management activities. Then the okay, sir. I'll take care of. No problem. I'll take care of it. And I work in the field of healthcare waste management as well as the water quality management. Presently, I'm working as region director, Central Project Control Board, and I am the in charge for the state of Karnataka, Kerala, Goa, and Lakshadweep, and all the issues relating to the pollution control management in these four states. I had to take care of as a region director at CPC with the Bangalore office. This is my background. I dealt actually the subject between 2009 to 2016, 2017. When I was in CPC Delhi office, all the amendments were brought out by me only. All the new rules were brought out by me only, and of course with the support of various stakeholders. And that is my background. And coming to the classes allocated to me, I was told to take classes between 6 to 10 of October, between 4 p.m. to 6 p.m. Therefore, I'm going to take up the issues like the what are the various rules related to biometric waste management, and also what are the pre-treatment and disposal options available, and what are the burn and non-burn technologies, and what are the various regulations in SARE countries and in other countries. This is what I'm going to deal in 4 days. Next 4 days, 6th to 10th October, 9th October. I'm sorry, not 10th, 6th to 9th only. And after having my classes, I may show you some sort of the object type questions which you can answer. And if you are having any problem relating to my subject, you can ask me. I can try to clarify whatever I can do. This is about my background. And coming to the today's yeah, can you see my slide, please? Yeah, somebody has to respond. Don't think that I'll be talking on my own, and you have to be responsive, and you can put off your mic. You can put off your mic when I ask. You can respond to my queries, please. Okay. Can you see my
Yes,
slide,
sir.
please?
Yes,
Yes,
sir.
sir. Yes, sir.
Slide is visible.
Visible, sir.
Therefore, you have to be active. You have to be active. Don't see that this class is going to be okay. No, I'm sparing my official time. Therefore, I expect that you will be active. After my before concluding the presentation, I'm going to show you question papers, means questions and answers, some objective types, so that that may be useful for your the examination also. Going to the directly to the topic is concerned. Today we are going to deal the subject on BMWM management rules and amendments, and which is a part of BHM101 Block-4. And as you know, there are some norms are there for establishment of healthcare facilities. They are like primary health centers. At least there should be one primary health center for every 30,000 population in plain areas. In plain areas, if you want to have one primary health center, at least one should be there for every 30,000 population. Whereas in hilly areas or difficult or tribal areas, there should be one the primary health center, at least one primary health center for a population of 20,000 population in hilly or tribal areas. This you have to remember. And also similarly, the community health center should be there at least for every 1,20,000 population. At least there should be one community health center for a population of 1,20,000 population in plain areas. Similarly, in case of hilly areas or difficult areas, tribal areas, there should be at least one community health center for every population of 80,000. Similarly, there should be sub-centers. There should be one sub-centers at least for every 5,000 population. In plain areas, one sub-center should be there. In case of hilly areas, for every 3,000 population, there should be one sub-center. This is the norms prescribed by Ministry of Health and Family Welfare, and according to these norms only, they will try to establish healthcare centers in the country. And they suggest states also. You all know, healthcare facility is a generator of all sort of waste, which includes infectious waste, biomedical waste, municipal solid waste, hazardous waste, chemical waste, used batteries, electrical and electronic waste, plastic waste, construction demolition waste, radioactive waste, liquid waste, emissions from boilers, diseases, captive incinerators, etc. That means if you take any small industry, they may be, if you know the raw materials and if they are manufacturing only one product using simple raw materials, then the product may be one product, whereas the waste generation may be not one or two type maximum. Here, hospital, if you take as an industry sector, and patients are your the raw materials, and the dialysis process and the treatment process, if you take it as raw materials, then your the output will be a patient who has recovered from his ailment. That is the product. Therefore, in the process of treatment of a patient, the hospital is generating most of the waste that I shown here, which includes infectious, municipal solid waste, hazardous waste, used batteries, electrical, electronic waste, plastic waste, construction demolition waste, radioactive waste, liquid waste, the emissions from boilers, sets will be there. Of course, if at all, if there is a captive incinerators, then you may be generating the emissions from the captive incinerators also. If you take up the total hazardous waste or biomedical waste generated from the hospitals, non-efficacious is about 80%, and infectious waste is about the 20%. Therefore, these waste are required to be segregated separately. Infectious hazardous waste has to be separated, and non-infectious hazardous waste has to be the non-hazardous waste has to be separated separately, segregated properly, and segregate it and keep it separately. If you mix up, then you are converting your 20% infectious hazardous waste. That means what you call it as a biomedical waste into complete even non-infectious waste also are going to be converted into infectious hazardous waste. Therefore, these waste has to be segregated by the hospitals at the source of generation itself. At the source of generation. Please kindly remember some words, whatever I am insisting 2 or 3 times, that words you have to remember. Means that is going to be a part of definitely you will expect in the examination, in the object type of examination paper. And what is the proportions of waste generation from healthcare facilities is general waste, I told you about 80%, whereas the infectious waste is about 20%. Infectious waste is 20%, which includes infectious and anatomical waste. Short waste is around 1%. Chemical and pharmaceutical waste is about 3%, and genotoxic, radioactive, and waste with heavy metal content is about 1%. Therefore, the waste generated from hospital has to be segregated. That is, mainly 20% of infectious waste has to be segregated properly, and you should not mix up with any other waste, so that you are not going to convert the non-infectious waste into other waste. Why you have to worry about the segregation at source? Because it is going to, if waste is not properly segregated and managed properly within the hospitals, it is going to cause health hazards and risk. Therefore, who are going to be at risk? Mainly the doctors, nurses, and patients. Of course, some supporting medical staff. Of course, collection, disposal, and facility staff. General public and environment also is going to suffer if the waste generated from hospitals is not properly collected, treated, and disposed of. Then such waste is going to cause impact on the healthcare staff itself, which may be medical and paramedical staff, and waste collectors, and waste disposal facility, the operators, and also it is going to cause the impact on the general health and general public as well as the environment. Who are the at risk? Generally, healthcare workers include the doctors and nurses, and it causes the impact infections to the rag pickers and waste collectors, and also going to cause impact on the poor. It is going to cause the poor aesthetics, and is going to cause impact on the stray dogs and rodents. They also spread diseases. And if waste is not properly managed or disposed of, then it's going to cause impact on the water bodies, and also it may cause impact on the air pollution. If it may cause impact on the air pollution, like air pollution, if waste is burnt improperly, therefore it is going to cause impact on the environment also. Who are at risk is mainly it may cause impact on the various risk associated with healthcare waste. Improper management of healthcare waste is medical staff will be suffered, support staff also will be suffered. I told you, other the public will be suffered, and it may cause the waste diseases like HIV, AIDS, hepatitis, cholera, and dysentery. This sort of the infections may be spread onto the environment, on the public, general public also. Therefore, waste generated from the hospital has to be segregated properly, and it has to be treated and disposed of safely, so that it is not going to cause impact on the general public, and also not going to cause impact on the environment. That is our responsibility as the medical and paramedical staff. Coming to status of healthcare waste management is concerned, let us have a look at the very old data. If you have a look at 2008 and 2014, the number of hospitals have gone up almost double the hospitals. In 2008, there were about only 95,273, and 2014, 1,69,505 hospitals. These are the registered hospitals, I'm telling you. Of course, this number has gone up. I will show you that numbers also. This is as per your syllabus. At that time, they prepared the materials for this 6 months certificate course. The data which was required at that time they are given. I will update this data also, no problem. And the number of healthcare facilities which they used to utilize the services of common facilities in the country, means common biomedical waste treatment facilities. They are the treatment facilities on behalf of hospitals. They collect waste and transport it and treat and dispose of this waste safely, so that it is not going to cause any impact on the environment. Therefore, in 2008, about 60,434 hospitals they used to depend on the common facilities, whereas in 2014, about 1,38,034 hospitals used to depend on the common facilities, common biomedical waste treatment facilities. Rest, you may ask me, sir, how they used to dispose of remaining people? They used to dispose of by means of own treatment options, by captive treatment facilities, or by having the burial options. Therefore, they may not be the members of the common facilities. And these are the captive treatment facilities. They may be having their own treatment facilities. In between 2008 and 2014, if you see, in 2008, there were about 11,948 hospitals used to have their own treatment facilities. This number has gone up till 2014. After the rules have come up, we are discouraged to have the captive treatment facilities, because operation of captive treatment facility is a costly affair, and it is going to cause, if it is not properly operated, it is going to cause impact on the environment. Therefore, we are discouraged to have the captive treatment facilities by the hospitals, and we are encouraging to have the member of the common facilities, so that locate nearby common facilities, they can ensure proper treatment and disposal of general biomedical waste. In 2008, we have about 177 common biomedical waste treatment facilities in the country. This number has gone up to 198 in 2013, but in 2014, the number has gone down, maybe due to the action taken by the state boards or CPCB would have taken actions, and that 6 industry and the common facility might have been closed because of violations of the rules. Therefore, number has gone down. Similarly, there is a variation in the numbers. That may be the reason. Whenever violation is there, action would be taken, then industry, that common facility might have been closed or may not be in operation due to certain reasons. And this is the generation scenario between 2008 to 2014. If you see, the biomedical waste generation scenario is about 400 tons per day. In 2008, that has gone up to maybe around 475 tons per day, maximum between 2013 and 14. Now, coming to scenario, what is the scenario in 2021? The biomedical waste management scenario in the country in 2021 is around number of healthcare facilities around 3,75,000. Now it has gone, number has gone up. If you see, in 2014, 1,69,000. Whereas if you see the number of healthcare facilities, number has gone up from 14 to 2021, over a period of 7 years. The number has gone up to 2 lakhs. Healthcare facilities has come up. They have registered under the. Then 2021, we used to generate about 764 tons per day of waste, and we used to collect and treat about 721 tons per day of waste somewhere in 2021. Now this status has been updated by the CPCB based on the annual report submitted by various state boards, annual reports submitted in for the year 2023 by all the state boards. Now the number of healthcare facilities is gone up. See, numbers are day by day is going up because of treatment. Ailments are going up day by day. Therefore, we are having different types of diseases. People are suffering, and number of hospitals are also going up. Therefore, as on date, as per annual report 2023, there are about 4,35,000 healthcare facilities, and we are generating about 740 tons per day of biometric waste. Out of that, we are collecting only 694 tons per day of waste only. As on date, means 93% of waste is collected, treated, and disposed of. Remaining 7% is going as 6.6% is going as a part of municipal solid waste. Of course, some violations are there. You can see there are violations by the hospitals, violated for the BMWM rules. About 20,000 hospitals. Action would have been taken by the states. About 8,082 hospitals have been given show cause notices by the state police boards or CPSB itself. And if you see the waste treatment capacity in the country, the generation I have, the waste generation is about 740 tons per day, whereas I got the capacity of 974 tons per day. It is a cumulative capacity. Now, it does not mean that all areas may be having the adequate treatment capacity for management of this waste. Now, if you go into zone-wise, then all facilities, all that zones may not be having adequate facilities. But it is a cumulative capacity. All over the country, we have got 974 tons per day of capacity. We can have the capacity to treat, whereas the generation is about 743 tons per day. That means we have got the capacity, adequate capacity, but it does not mean that all the zones in the country is having adequate capacity, because of in that some particular areas you may not have the treatment capacity at all, the facility at all. For example, if you take northeastern states, like if you go apart from Assam, if you go to Nagaland, Mizoram, Meghalaya, Arunachal Pradesh, Sikkim, and we don't have the common facilities in these northeastern states. Therefore, though capacity is there, all over the country capacity is there, but still, if you take certain parts, I don't have still the common facilities. Therefore, they are going for disposal by deburial only. That's how we have to understand. Now, what are the various rules? Any questions, please, till time? If you want to ask me any questions, you can ask me, please. Any questions? Any questions? You're free to ask any questions, please. Any questions, ma'am? No questions. Okay. Okay, then I will go for next slide. We got various rules have been notified by the Government of India for management of different types of, in order to control the pollution, control measures as a part of control measures. We got mainly the Water Act. Water Act has been notified in the year 1974. Therefore, the first act notified the Government of India for the control of water pollution. Therefore, Water Prevention and Control of Pollution Act 1974. You have to remember this, the figures also, please kindly remember. Then similarly, subsequently, we have got in order to control air pollution, we have got Air Prevention and Control of Pollution Act 1981. And from 1986 onwards, all the rules from 1986 onwards, all the rules notified under the Environmental Protection Act. Therefore, whatever the rules are there, these are the rules. Any rules notified to the Government of India, all these rules are notified under the Environmental Protection Act 1986 only. Therefore, we call this the Environmental Protection Act 1986 as the Umbrella Act. We call it as an umbrella act. What are the various rules are there under the various Protection Act? We got Public Liability Insurance Act is there. Similarly, we have the Manufacture, Storage and Import of Hazardous Chemical Rules are there since 1989. We have got Hazardous Waste Management and Handling Rules 1989. Of course, these rules are replaced with the Hazardous and Other Waste Management and Transport Rules 2016 as amended. And we have got Chemical Accidents Rules 1996. We have got the Biometric Waste Rules since 1998. And these rules, 1998 rules, were replaced with the Biometric Waste Management Rules 2016. Of course, there are some amendments also. And we have got the other rules like Recycled Plastics Manufacture and Usage Rules 1999. Of course, these rules are replaced with the Plastic Waste Management Rules 2016. And Municipal Solid Waste Rules are there since 2000. And these rules are replaced with the Solid Waste Management Rules 2016. We have got regulations on noise pollution control, noise pollution regulation control rules since 2000. And we have got Batteries Management and Handling Rules 2001 onwards. These rules were replaced with the Battery Management Rules 2022. And the Construction and Demolition Waste rules were there since 2016. Of course, these are the rules are not there till 2016. But from 2016 onward, these rules have been framed by under the environment protection. Otherwise, these Construction and Demolition Waste rules used to be a part of Municipal Solid Waste rules earlier. And we have got EA notification for a start of any activity. Environmental clearance is required from either from the Ministry of Environment, Forest and some categories of waste. So there are two types of categories. One is category A and category B. Category A activities all require from environmental clearance from the Ministry of Environment, Forest, whereas all category B items requires the environmental clearance from the State Environmental Impact Assessment Authority. Therefore, these two categories are there depending on the type of category. They have to obtain the environmental clearance from the state, the Ministry of Environment, Forest, category A, and whereas category B, the activities requires the environmental clearance from the State Environmental Impact Assessment Authority of respective state in the respective state. And we have got e-waste management rules are there. Of course, e-waste management rules are also amended further in 2022 and followed by further 2024 also. This is about the rules is concerned. Just to sum up, there are subcenters. We require subcenters, at least one subcenter for every population of 5,000. And we require primary health center, at least one primary health center, at least for every 30,000 population. But a community health center should be there, at least one community health center for every population of 120,000 population. And we have got the related objects health policies. We have got various rules are there related to health policies. And we are going to take up these rules is concerned in depth so that we'll be knowing what are the various rules related to biometric waste management in the country. Please kindly refer to this website if you want to have a look at the biometric waste rules. You may kindly refer to this website, CPCB website. CPCB is nothing but Central Pollution Control Board website, or else you can refer to Ministry of Environment Forest website also. The rules are available. If you are going to refer to these rules, you will get all these rules amendment, whatever is there. Anybody is from a medical background, please? Anybody is there from a medical background? Anybody is there from medical background?
Yes, sir.
Ma'am, are you aware about these rules? How these rules have evolved?
Yes, sir. I believe there have been some incidences, environmental hazard and catastrophic incidences where needles and syringes were found on beaches and how the hospitals were disposing of. So following that, initially the rules, there were many categories. And then in 2016, these categories were narrowed down to 4 main categories, depending on how further it will be disposed of.
Thank you very much, ma'am. I think, where are you from, ma'am?
Sir, I'm from Chandigarh.
Okay. Oh, Chandigarh. I
Yes,
used to
sir.
come and I think so I had delivered lectures there in Chandigarh.
That's nice, sir. Come again.
I don't know. Now I'm in South. I don't have opportunity, but that conference operator, I know him.
Yes.
I know the conference operator in now Ramki is doing the conference. Earlier, Mr. Malhotra used to be there. He is no more. He has expired recently. Therefore, he has sold it off. I used to come to Chandigarh Medical College. I used to deliver lecture there.
Okay, sir. Okay.
Thank you.
I'm from 16 hospital, sir.
Okay. Yeah. Anybody else can? history of the BMWM rules? Let me choose then. Sophia, madam. Sophia Thomas G. Can you please tell about when these rules were notified? What is the history? How these rules have been brought out? Sophia Thomas, madam G.
Yes,
Can you
sir.
please
Yes,
respond?
sir. Yes,
Can
sir.
you switch on your mic, please? Your
Yes, sir.
video, please. Cameraman. Camera, can you switch on?
Yes, sir.
How these rules have been evolved? If you can say some.
The same way that some incident should have been happened, what we saw during Corona, the people were throwing away PPE kit anywhere. So same way, it could have happened before, and the rules there how it evolution of rules and regulations were. We could see the evolution and formation of these rules.
Thank you. Thank you.
So
Where are
how
you
they
from, ma'am?
described them.
Where are you
I'm
from?
from Karnataka, sir.
Karnataka. Which part of Karnataka, ma'am?
Mandya, sir. Mandya.
Mandya. Okay.
Working as staff nurse in Chinkuruli, CHC.
Okay. I think so. Mandya, I not come. I not come and delivered in lecture. Hassan, I have come. Hassan, I visited.
Okay.
I delivered lecture. You request your conference operator. Who is the conference operator there in Mandya? Just
Presently, we don't have any. One person we had, Anand, and he left the job. Now, presently, we don't have anybody.
No. For Mandya, there may be some conference operator may be providing treatment services. They may be collecting the waste from hospital.
Facility. I understood. Common facility. It
Where
is in
there?
Mandya district. Common. No. We have in Maradi, near
Maradi.
Kanakpura. Yeah, Maradi.
Kanakpura. Okay, Maradi, Kanakpura. No. Okay, I will tell them to Mr. I think so. There is a Maradi. There is one fellow, Mukesh Kumar. Somebody. He is from Jharkhand. I think he is the fellow who is taking care. I will tell him to organize one program for you people. Manja.
Thank you.
Nice of you. If any hospital is offering, any government hospital is having any auditorium and all, I myself can organize, no problem.
Most of the government hospitals have we have tied up with Maradi only, sir.
Okay, no problem. I will tell them to organize some program for you people. Okay, ma'am.
Okay, thank you, sir.
Let us go to how the history of the rules have evolved. As stated by you people, waste may be disposed of hazardly, therefore rules have come. Yes, that cause is correct. There was one writ petition was filed by Dr. B.L. Vaderera in 1995 before Honorable Supreme Court against Union of India regarding the one of the hospital by name called Sabdarjung Hospital. They used to dispose of all the waste at Balswa dump site on the bank of River Yamuna. And whenever there is a monsoon is there, all the waste is to go along with the monsoon water. Therefore, they have suggested, they have filed a case. The Honorable Supreme Court in the year 1996, they passed directions stating that 50 and above hospitals should have their own, in Delhi only they told, to have their own treatment and disposal facilities. But not only in Delhi, all over the country there used to be hospitals and improper waste management was happening. Then the Ministry of Environment Forest have come out with the notification called BMWM Waste Management and Handling Rules in the year 1998. Thereafter, after gaining experience, there were some lacunas in the BMWM Waste rules. Based on the lacunas observed and all these gaps have been observed, filled. Then the Ministry of Environment Forest have come out with the new rules called BMWM Waste Management and Handling Rules 2016. Therefore, the earlier rules 1998 were there. They have been replaced with the new BMWM Waste Management Rules 2016 onwards. Therefore, now whatever you are having is the latest rules and filled all the gaps. No, whatever the gaps were there that has been filled, and these rules have been notified in the year 2016. Therefore, 1998 rules were replaced with the new rules called BMWM Waste Management Rules 2016. And these rules have got 18 provisions, very simple provisions. Title, application, what are the definitions, what are the duties of the occupier. Occupier is nothing but generator. What are the duties of the conflict operator? What are the duties of the authorities? How the waste has to be treated and disposed? How the waste has to be segregated, packaged, transported, and storage? What are the authorities for enforcement of the rules? And what are the procedures to be followed for authorization? And what is the advisory committee should have in the state level? Monitoring how the monitoring has to be done, whether the rules are implemented by the healthcare facilities or not. Annual report submission is one of the clause, and maintenance of records, how long you have to maintain these records, and after all, if there is any accident reports, how it has to be reported. And in case if you are not happy with the actions initiated by any state board, then you can go for appeal, for whom you have to appeal, and by how many days they have to dispose of the appeal and all has been clearly mentioned in the BMWM Rule 2016. And for future development of any complexity, every local body has to choose some site and that keep and allocate sites for development of any complexity in the future, because the population is going up, number of hospitals are going up, waste generation is going up, the waste they should be able to treat and dispose of which are very close to the hospitals. Therefore, site has been suggested to the local bodies to allocate so that for future development of any complexity can be developed in future. Suppose in case if you violate the rules, what are the liabilities available on the rules? Yeah. What are the liabilities on the violators, like generator as well the complexity operator? And the rules are having 4 schedules. What are the schedule 1 talks about what type of BMWM waste categories are there and how to segregate them, how to collect them, how to treat it, how to process it, and how to dispose of the treated waste. And if you want to operate any treatment equipment, what should be the standard for treatment equipment? Or if you want to dispose of any waste, and what are the precautions to be taken, how it can be disposed of the BMWM waste. And Schedule 3 talks about who are the authorities, what is their responsibilities. And Schedule 4, and what type of label should be there for BMWM waste, containers or bags. Similarly, we have got 5 forms. What are the Form 1, accident reporting. If there is an accident, then how it has to be reported. And Form 2, how to obtain the application, the authorization for it is the application for opening of authorization. Authorization is nothing but permission to be obtained by the hospital from the State Pollution Control Board for the purpose of what? Generation, collection, treatment, storage, and disposal. And Form 4 is annual report. You have to submit annual report by all the hospitals, whether it is a bedded hospital or non-bedded hospital, by 30th of June every year, you have to submit the annual report information. And Form 5, application for filing appeal against, if you are not happy with the orders passed by any state political board, you are complying with the rules, but they have passed some orders against your hospital, then you can go for appeal. For whom you have to appeal and all. These are the rules. Anybody heard of the BMWM Rules 2016, please, from this batch? Anybody has gone through the BMWM Rules?
Yes, sir.
Who has gone through the BMWM Rules, ma'am? Have you gone through the BMWM Rules?
Yes, sir. I have gone through 2016 rules.
Okay. What are the major rules, ma'am? Can you say something?
Sir?
What are the major rules?
Major rules about biomedical waste disposal, how it should be done?
Yeah, how the BMWM waste has to be managed. The rule says. Whatever the way you understood, can you say, ma'am?
Hanji sir, the biomedical waste management, it comprises of, first of all, segregation of the waste wherever it is being produced. And first of all, authorization we have to get. If any facility is set up, then we need to obtain an authorization certificate. And then we need to have a link up with the common biomedical waste treatment facility, which should be within 75 kilometers of radius. And once the facility is operational, there should be segregation at the source, at the point of generation. The biomedical waste segregation is done under 4 categories, which is yellow, red, blue, and white. And it also outlines how it should be transported to the storage area. And from storage area, it gets collected and is taken to the common biomedical waste treatment facility. You want me to give the categories, sir?
No, not required, ma'am. Not required. I'm just asking you what are the salient features about the rules? What are the way you know? I think so. Most of the issues you have covered. Anybody else can say? Are you aware about the rules?
Yes, sir.
Yeah. Can you switch on your camera, ma'am, if you don't mind?
Okay, sir. Good evening, sir.
Good evening, ma'am, please.
Sir, there are many rules in the biomedical in 2016, like the segregation at the source, like any biomedical waste should be segregated into, as told by Madam, four color coded containers. They are yellow, red, two blues, and one white at the point of generation. Then treatment and disposal of the biomedical waste by the methods incineration, autoclaving, and deep burial. Then barcoding and GPS tracking, and we should avoid any mixing. The like prohibition of the mixing should be there, and then there should be authorization from the state pollution control board, and there must be common treatment facilities, and there should not be any individual systems for the disposal of the waste, and there must be record keeping or training for the biomedical waste. These all are the, I think, major rules which comes under 2016.
Yeah, fantastic. I think so. You have covered most of the aspects. Both of you have covered most of the aspects, and you are aware about the rules, definitely. But still, some tricky things are there, which I will explain in detail. That you should know what is the things and all. Yeah, please. Thank you very much, ma'am,
Thank you,
for both of
Thank
you
you.
to respond positive. Yet interact with me. Please kindly interact with me. Otherwise, no use. The rules came into force. Earlier, I told you the rules came into force from 28th March 2016 onwards. That you have to remember this date, so that it is one question can be expected from the definitely from the in the examination. And you should remember, anybody has been exempted. Anybody can say. Anybody has been exempted from the rules. If you see the very important statement here, very important. The rules shall apply to all persons who generate, who collect, who receive, who stores, who transports, who treats, who dispose or handle biomedical waste in any form. Over. If you go through this sentence, this is a very dangerous rule indicated in the rules. None of them have been exempted. Can you please, who is the generator of biomedical waste in the hospital? Can you please tell me who is the generator of biomedical waste in the hospitals?
All the healthcare providers.
See, patient is there. That is your raw material. Your diagnosis is your treatment method. Treatment, it is a process of treatment. Therefore, waste is generated by all the laboratory staff, isn't it? In testing the various things, they are going to generate. Therefore, they are not being exempted. Doctor is there who is going to surgery, doing surgery. Is he being exempted? No. He is going to treat the patient in the process of treatment of the waste. He is going to generate waste. Therefore, he is also generator. He has not been exempted. Nurses and other supporting staff, they are also not been exempted. Like collecting waste. A person who is bringing a trolley into the ward and collecting the waste and transporting it to temporary storage yard within the hospital. He has not been exempted. They're also a part of the rules. And receiver, who is the waste receiving? Waste is going and given at one storage yard temporarily. There will be one person who is in charge for temporary waste storage area. Therefore, he is also not been exempted. And a person who is storing the waste is also not been exempted. Person who is involved in transportation, not been exempted. A person who is going to treat the waste means either the waste may be treated on-site or waste may be treated off-site. On-site means within the hospital. Off-site means as a part of common biomedical waste treatment facility. Now, some type of waste requires pre-treatment within the hospitals. Therefore, even treating any person involved in treatment of waste within the hospital as a part of pre-treatment, they're also not been exempted. For dispose of waste, they're also not been exempted. Any handling of biomedical waste, all have been covered under the rules. None of them have the medical staff or paramedical staff have been exempted from the rules. Every hospital has been covered under the rules. Therefore, this rule is very dangerous. Always you show anybody, if you want to talk about rules, you show this rule part first. None of them has been exempted. They should be under the impression that I've been exempted. No, every medical, paramedical staff or any person involved in handling of biomedical in any form, all are involved, all are covered under the rules. Action can be taken against anybody. Rules can take actions against the violators. Even hospital as a whole action can be taken, or individual officials also on medical and paramedical staff also can take actions individually also. You are also not been exempted. Similarly, the hospitals, nursing homes, clinics, dispensaries, and all hospitals have been covered. Veterinary hospitals, veterinary institutions, animal houses have been covered, and pathological, forensic, and research laboratories have been covered. And also, research or education have been covered, and also camps relating to healthcare facilities. Now, this is very important. Without obtaining permission from the state president board, even we cannot organize camps related to health checkups, or medical, or surgical, or vaccination, or blood donation. Camps you cannot organize without obtaining permission from the state president board. It is a must. And even the schools with first aid have been included, covered under the rules. Therefore, they have to take permission from the state political boards. Similarly, various ways are there. All that waste has to be managed in accordance with the respective rules. Like radioactive waste, that has to be managed in accordance with the Atomic Energy Act 1962. Hazardous chemicals, it has to be managed in accordance with the manufacture, storage, and the import of hazardous chemicals rules. Solid waste, you have to manage in accordance with the solid waste management rules 2016. Lead-acid batteries, you have to manage in accordance with the batteries management handling rules 2001, and also as per the amendment brought out afterwards. Hazardous waste has to be managed in accordance with hazardous and other waste management handling transport rules 2016 onwards, and e-waste has to be managed by e-waste management rules, and all other waste has to be, apart from biomedical waste, all other waste has to be managed in accordance with the respective rules. Therefore, only biomedical waste has to be managed in accordance with the biomedical waste rules. All other waste has to be managed in accordance with the respective rules notified under the Environment Protection Act. Therefore, hospital has to dispose of the various waste in accordance with the respective rules notified by the Government of India. Not only the biomedical rules are applicable, all other rules which are applicable has to be complied by the hospitals. That is about the rules are concerned. Now, anybody can tell me, how do you define the biomedical waste? Actually, I used to challenge, if I give the lectures, I challenge first question is, define biomedical waste. And I used to give 500 rupees declaration. If anybody gives a response to my question, I used to give 500 rupees. No, I cannot present here 500 rupees. Anybody can tell me, how do you define biomedical waste? Don't
Yes,
read
sir.
it. Yeah.
Sir, biomedical waste means any waste which is generated during the diagnosis, treatment, or immunization of a human being, or in any research activity.
Why you required to know the definition? Why you have to know about the definition?
Uh, Sorry, sir.
Why you have to know about the definition of biomedical waste?
Uh,
Any
so that we so that we would be able to know the how biomedical waste is generated, and what can be the sources.
Yeah. Ma'am, madam, can you please tell what is your
Bio-
why you should know about the definition of biomedical waste?
Sir, because biomedical waste could be infectious waste also,
Hmm.
and we should not mix this infectious waste with the general waste, and therefore we should clearly know what biomedical waste is.
Yeah. All of you remember one word called dirts. 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 If you remember this word, you will define the biomedical waste. I will say now. Okay. Authorized, you know that it is a permission which you have to take from the state political board for the purpose of generation, When do you generate biometric waste, please? Anybody can say? When do you generate biometric waste?
Sir, at the time of
Doing
diagnosis, treatment, or
procedure,
during immunization process, or any invasive or non-invasive
surgery.
procedure.
Now, rule says, you just understand why I'm stressing. If you know, then definitely you'll be cautious. Otherwise, very difficult. Rule says permission has to be granted by the prescribed authority for the purpose of generation. When do you generate? When you treat the patients or diagnose the patient and all, then only you generate the waste. Collection, reception, storage, transportation, treatment, processing, disposal, or any other form of handling of waste for which you have to obtain permission from the state political board. Now, when you treat patient, then only you generate waste. Therefore, now as per this definition, can you without authorization, can you operate your hospital? No, you cannot take. Therefore, all of you should remember, you have to obtain permission for the generation. When you are going to generate the waste, when you are going to treat the patient. That means without permission, you cannot treat patients. That's why you have to take permission from the state political board, then only the hospital has to operate, for which you have to obtain authorization. That is a must. Okay, that's how you have to understood the rules part. And one more thing, I told you to remember one word called DIRTS. DIRTS. Why? I will define the biometric waste now. DIRTS. Biometric waste is nothing but waste generated in the process of diagnosis. I agree with you, Yamini Sud Madam Ji. I agree with you. Waste generated in the process of diagnosis. D for diagnosis. Waste generated. I for DIRTS. I told you, DIRTS. DIRTS you can remember easily. If you remember this word, you will define anytime. If somebody asks you, you will say definition definitely. I is nothing but waste generated in the process of immunization of human beings or animals. Okay. R for waste generated in the research activities. T for waste generated in the process of treatment of human beings or animals. T for treatment of human beings or animals. S is nothing but schedule. What are the waste are referred in the schedule 1 can be called as the biometric waste. Now I will say indirectly without seeing the definition. I will say now. Waste is nothing but waste generated in the process of diagnosis is called as biometric waste. Waste generated in the process of immunization of human beings or animals is called as biometric waste. Or any waste generated in the research activity pertaining to medical field is called biometric waste. And T, when waste is generated in the process of treatment of human beings or animals, it is called as biometric waste. And yes, in English we say one word called etc. We use one word etc. Here, word is there, yes. In place of etc., we are using one word, yes. Means something is not covered and we are referring to schedule. Schedule 1. Schedule 1 talks about various types of waste. If you remember, you can define easily definition of biometric waste. Yes. Waste generated in the process of diagnosis or immunization of human beings or animals or research activities or treatment of human beings or animals and waste referred to schedule 1 is called as biometric waste. Now, why I am telling you to know the definition of biometric waste, I will tell you one example. A person is there walking on the street, he died naturally. Person walking on the street died naturally, and a person walking on the street met with an accident. He was brought to the hospital. The doctor has amputated his leg because of safety of the patient. He has amputated his leg, considering the safety of the patient. Now, I got two types of waste. One is a dead person. Yeah, Sophia Thomas, Madam Ji, may I request you kindly keep your microphone in off, please. Sophia Thomas, Madam. Yeah. Now, there are two types of waste. One is a person who is walking on the street, died naturally. There is a dead body is there. Now, there is one more, the waste is there. Person walking on the street, then met with an accident, was brought to the hospital, then, unfortunately, his leg has been amputated by the doctor, considering the safety of the patient. Now, one is there, dead body, naturally a dead person, and one is there, amputated leg part. Now, if I ask you, which is the biometric waste, can you please tell me which is the biometric waste? Yes, ma'am, please respond. You can.
Amputated leg.
Amputated leg. How you have arrived? How you have arrived? How you are told to amputate leg?
So because that amputated leg has to be disposed of
No,
because
no, no.
during treatment,
Why, how you have arrived, then you have to refer to the definition.
treatment है ना sir, it
Uh,
was the treatment
Waste
that was
generated
a
in the
natural
treatment
death.
of, that was a natural death.
हाँ.
Suppose why I'm telling you, to understand anything, you have to refer to the definition first.
हाँ.
If you have not understood, then you have to go to authorities to clarify it. Now, anybody ask you this question when your two ways are given, and then first question you have to see, you have to refer to the definition, how defined, waste has been defined. Now, I got two categories. One is dead animal, dead body. Other one is a amputated leg. Amputated leg generated in the process of treatment of a patient, treatment of human being. Now, the rule says, anyway generated the diagnosis or immunization of human beings or animals or research activities or treatment of human beings or animals and waste of under Schedule 1. Therefore, the amputated leg falls under one category, treatment of human being. Therefore, you could able to answer that the amputated leg is a biomedical waste. That's how we have to examine the critical issue when there is something has come to your end without taking the help of somebody. You can define yourself by referring at the definition. This is what this is the purpose of understanding definition. If you know this definition, I think so you are the best person in the world. I'm telling you, you are the expert. You can do best job now. If you have understood the definition, you know everything now. What I'm going to teach you is going to be a very easy task for me. Now, come back to my topic. That's why I ask you whether you what is the definition of, what is the importance of definition. Of course, other definitions are very simple and not required to be examined told by me. Occupier is nothing but the generator of biomedical waste. Generator of biomedical waste may be individual official, individual medical, paramedical staff, or other person involved in handling of biomedical in any form, or as a whole, as a hospital, can be called as occupier. Operator capacity, he will be involved in treatment and disposal of waste on behalf of any hospital or by having his own treatment facilities. Now, what is the duties of occupier? Rule says to take all necessary steps. Take necessary steps for, as per biomedical rules. Yes, that is okay, understood. Then, rules also says segregation of waste as source. This is very important. Kindly remember, waste has to be segregated at which place? At which place, please?
Point of generation.
At point of generation only. That you have to remember. There's one question I can expect. And you have to keep the waste in a safe, ventilated, and secure location for storage of segregated waste. Okay, and no secondary handling. You cannot transfer waste from one bag to others. You are not permitted to transfer the waste. And one type of waste is required. 4 types of waste are required. This you have to remember. Please can you remember these words? Pre-treatment is required in case of laboratory, microbiology waste, blood samples, and blood bags. 4 categories of waste requires pre-treatment. What are they? Laboratory waste, microbiology waste, blood samples, and blood bags are required to be pre-treated by the hospital itself. Then only it has to be segregated. How to segregate that I will tell you later on. Phase out use of all fluorinated plastic bags.
Sir?
Of course, some have been exempted. Yes, please.
Sir, excuse me, sir. Is the PPT being shown to others also? Because I am not able to see any presentation now.
Yeah, 1 minute.
I think the screen has got changed something somehow.
Yes, sir. Screen is not visible, sir.
Screen is not visible. I don't know how come it has changed. Something has changed.
PPT नहीं visible है sir. I think the screen sharing has got ऐसे changed somehow.
Okay, 1 minute. Can I go back and restart? I think let me try that way. How it has gone, I don't know.
बीच में सर मैसेज आया था वो स्टॉप वाला स्क्रीन शेयरिंग वाला.
Okay, I just will come back. Give me 2 minutes, please.
Yes, sir.
don't know. Something happened. Yeah, can you see now?
Yes, sir.
Yes, sir.
Okay. Then to provide training to all the healthcare workers at the time of induction, training has to be organized, and at least once in a year, there should be training program to be organized by the healthcare facility itself that organize training programs. And also all the records has to be maintained, the training programs and waste, how much waste is
Excuse me, sir.
generated. Yes, please.
Again, the screen is gone, sir. Screen sharing has stopped.
I don't know how come it is. Is it okay, ma'am? Can you see now?
Yes, sir.
Okay, okay. Therefore, the immunize all healthcare workers also, at least against hepatitis B and tetanus is a must as per the rules, and establish a barcode system. Can you please tell me what is the advantage of barcode system? Can you please tell me what is the advantage of barcode system?
Sir, we are basically able to know the source of generation one for where it is referred to, and we can always have a data of the details for a certain period of time, sir.
Yeah, what is said is correct, Ravi Kumar ji, Ravin ji. Now, suppose if you use any barcoded bag used in the hospital for any other purpose, let us say solid waste, and that waste has been disposed of on any roadside. Now, as a regulator, if I find that waste, that so-and-so waste is lying and the bag is having barcode, I can trace out who is the culprit. Therefore, never use any barcoded bags for any other purpose and never involve in disposal of such bags anywhere else. Otherwise, it becomes the wrong thing on the healthcare part. Therefore, for example, any waste has been segregated, bomb waste has been segregated into color-coded bag, provided with a barcode. If you are disposed by mistake on the roadside, and I can find out based on the barcode system, I can trace out who is the generator of that barcode. Therefore, in order to identify the source of generation of waste, the barcode system has been introduced. Because the centralized system, through whatever the waste is collected by the conference operator, when he scans it, all the data will go to centralized portal. All the data will be there on. And if any bag is found like this, and we can trace out easily who is the generator of that particular waste. And also, the very important thing is that the ensure treatment, this liquid waste also you have to ensure. And also all the chemical liquid waste has to be neutralized. I'll show you how to neutralize also. Ensure occupational safety of the healthcare workers by providing PPEs. Without PPEs, never allowed the waste handlers to handle the environmental waste within the hospitals or outside the hospitals also. And the health checkups has to be carried out by the hospitals for every healthcare workers at the time of induction and at least once in a year. Once in a year, health checkups has to be organized by the healthcare facility. In case of any existing incinerator is there as a part of the captive incinerators, they have to comply to the standards notified under the rules within 2 years, especially for the dioxin furans, which are the highly carcinogenic emissions. When you treat the PCB bearing waste or chlorinated plastics and all, then definitely dioxin furans will be generated, and for which the captive incinerators have to be complied by the standards within 2 years. Report major accidents, including fire, in Form 1 to the SPC. Therefore, if all any fire accidents are there, that you have to report in Form 1. These forms you have to remember numbers. Please, Form 1 for accident reporting, that you have to report, that you have to remember. Then maintain register regarding the day-to-day basis with regard to the biomedical generation, how much you are collecting, how much you are disposing through confidentiality operator, everything records has to be maintained, and all these records has to be uploaded in the website, and all the bedded hospitals should have their own website, and the data has to be uploaded in the website. And one more important thing is that inform SPCB or PCC immediately in case the confidentiality does not collect the waste. What is the next step for this? Anybody can say, please? I don't know. Every time something is happening here. Why we have to inform state board when the confidentiality is not taking the waste? Anybody can say, please? Why it is required?
It cannot be stored beyond 48 hours.
Yeah, some category. What type of waste you cannot store? There are some type of categories which you cannot store. That is, human, the untreated
Infectious
human
waste,
untreated waste, animal untreated waste. Some waste is required, cannot be stored more than 48 hours. Now, in case if you have stored more than 48 hours, you are not informed to the state board, the conflict operator has not collected from your hospital the waste, then it becomes your fault. Because you are storing more than 48 hours, it becomes your fault. Therefore, you have to inform to the state board when the conflict operator is not collecting the waste from hospital. That is your responsibility. Maintain all records at least for next 5 years. Remember these words. Next 5 years, you have to maintain all the records. You cannot throw the records. And a committee should be there for every 30 bed and more bedded hospital. The committee should be there. This committee should meet once in 6 months. In case of non-bedded hospital, the hospital having 30 number of beds, then they can have one designated officer who should take care of the waste management, healthcare waste management in the hospitals. That is the responsibility of the hospitals. And duties of the operator is more or less same. I don't think so. There are much differences there. Here, the barcode bags he can supply, of course, on rate basis only. And similarly, he also can report to the state board in case healthcare facility is not giving the segregated waste to the conflicting. He also can report against the hospital. So hospitals, they are not giving segregated waste. Therefore, action can be taken by the state board also. Therefore, the way you can report, in case he is not collecting the waste, he also can report against the hospital in case if you are not providing the segregated waste. That also you should be very careful. Otherwise, he also has to organize some training programs to the hospitals. And not only to the hospitals, he has to organize training program for the hospitals, for his workers, everything. And other responses are more or less same. There's no much difference. And various authorities responsible that I will tell you, show you separately, who are responsible. Coming to the treatment and disposal concern, biomedical waste has to be treated and disposed of in accordance with Schedule 1. And as per the standards prescribed in Schedule 2. What is the Schedule 1 and Schedule 2? I will show you separately. And no occupier shall establish on-site treatment and disposal facility if a service of a conflict is available at 75 kilometers. Now, for in case of Chandigarh, they got only one conflict, I remember. Therefore, no other option. Chandigarh is a small the city type, not even a big city. It's a small city. Therefore, 75 kilometers, I don't think so. It has got 75 kilometers width. Therefore, one facility will take care of the things. Now, city like Mumbai, it is having the large distance. Therefore, in a city like bigger cities, they may have two facilities also. For in case of Delhi, I think so. There are 2 COM facilities in Delhi, which can cater the services to all the hospitals in the Delhi. They are having the adequate facility, they can manage. Now, in any healthcare facility is there, if no COM facility is there, in such a case only, the hospital will be allowed to have their own captive treatment facilities. Otherwise, healthcare facility has to dispose of their waste through a COM facility which is located within 75 kilometers. This you have to remember. Always remember 75 kilometers distance, within 75 kilometers distance, whatever the COM facility is there, that you have to dispose of. Then only you will be allowed to dispose of the through COM facility. In case if no COM facility is there within 75 kilometers, then you will be allowed to have your own treatment facility, that is captive treatment facilities. Okay, that is you have to remember. Then any person or occupier after a COM facility intend to use new technologies, then you have to take necessary approval from the government, central government, for the purpose of laying down of standards is a must. You cannot use any technology other than latified technologies. You cannot use such the standards. I think there is something wrong with my operation only. I feel so. Suddenly, no, I don't know, when I'm shifting, it is going to change. Yeah. Therefore, other technologies defined the rules you cannot use on your own. Other technologies, if you want to use any technologies, any new technologies other than referred under Schedule 1 of the Schedule 2 of the rules, then you have to submit the proposal to central government. Central government will they examine the proposal, they will examine, and later on only they will allow you to use that one after laying down the standards only. Of course, the very important thing is segregation part. How to segregate? Rule says no untreated biogas shall be mixed with other waste. What will happen if treated waste is mixed with other waste? Anybody can guess, please?
So we won't be able to treat the waste appropriately.
Okay, any other things?
So the other waste will also become infectious.
Yes,
And
therefore
the total
quantum of
quantity that
waste
has
becomes
to be
more, then
quantum
the
of
quantum
waste
of treatment cost will become more,
become
and
more. Yes.
when you're treating more and more waste, definitely you're going to cause impact on the environment also. Therefore, the segregation of waste is very important. You have to segregate the waste at source of generation. Remember this word. At source of generation, you cannot mix up with other waste. Then it has to be segregated at in containers or bags as per the at the point of generation in accordance with the Schedule 1 only. Therefore, you have to segregate the waste in 4 color coded bags, and you have to further segregate as per the color coded given in the rules. That is 4 types. One is yellow, red, white, and blue. The containers or bags shall be labeled as per Schedule 4. Label means there are 2 types of label. One is biohazard label. This you can see. Can you see, please? This is the biohazard label, and other one is C. What is the label C meant for? What is the label C meant for? C for cytotoxic. It is for cytotoxic. Therefore, any label is meant for cytotoxic. In case of handling of cytotoxic waste, then you have to put the label of C. Whereas in other biomedical waste, you have to put biohazard label. What is the meaning of biohazard label? Any meaning is there? C, okay, C, I said cytotoxic. Whereas any meaning of biohazard label?
Sir, which imposes any threat to human safety or
Of course,
toxins?
it is a universal label used for handling of the infectious waste. And barcode system. Barcode system should be there for every vehicle handling the biomedical waste, and also the handling vehicles should be fitted with GPS. What is the importance of GPS? Any vehicle coming to a hospital for collection of waste, if it is not fitted with the GPS, we cannot trace it. If it is coming with a GPS, even you can take username and password of that GPS vehicle which is coming to your hospital. Ask for the username and password. You can track at what time it is coming, whether that vehicle is going to Comfesti or not. That you can check where it is going, how it is going, where at what time it is coming to your hospital. Everything you can check through GPS system. If you want, you can have access to that. Ask the Comfesti operator to provide the details. He will give you username and password. Then you can have track on that vehicle also definitely. And this is the one. All vehicles used for transport of waste should be registered under the Motor Vehicles Act. Otherwise, without registration, you cannot allow the Comfesti operator to collect the waste through his vehicle, unregistered vehicle. And these are the 4 types of waste. What is that 4 types of waste which you cannot store more than 48 hours? Untreated human analytical waste, animal analytical waste, soiled waste, and biotechnology waste cannot be stored more than. What is the soiled waste? Anybody can say? Soiled waste.
So
Yeah,
any waste
Akash.
that is used for
Contaminated with
dressings,
organic matters,
organic
No,
material,
no,
past body
no.
fluids,
like
Yeah,
human waste.
Blood and
yeah.
body fluids mixed with waste.
Yeah. Body fluids, maybe a blood or any infected body fluids, soaked with any cotton soaked with body fluids, maybe a blood or infected blood or any other fluids. It will be called as soil waste. And biotechnology waste. 4 categories of waste cannot be stored more than 48 hours because these 4 categories of waste are highly infectious. Therefore, the rule says these 4 categories of waste cannot be stored more than 48 hours. Kindly read. It says untreated biomedical waste. Untreated human ontological waste, animal ontological waste, soil waste, and biotechnical waste cannot be stored more than 48 hours. Isn't it? Suppose if we treated waste, then can you store it? Generally, the hospitals are not allowed to store more than 48 hours. But this type of untreated waste cannot be stored more than 48 hours. Suppose if you are required to store more than 48 hours, then how do you do then?
Maybe
Suppose,
with temperature control.
the first step, what you have to do, rules does not permit. You are taking permission from the state board for disposal of waste in accordance with the rules within 48 hours. Untreated waste you have to dispose of. But circumstances have come. Confidentiality operator, there is a fire accident occurred. He is not going to collect waste today or tomorrow also or next week also. In such a case, what do you do? Rule says you cannot store more than 48 hours of this, especially these untreated waste categories. In such a case, what do you do? First thing.
So we will label the waste and we will secure it in a locked area.
No. Label, okay, that is okay. Precaution you are taken. But rules does not permit to store more than 48 hours. First thing you have to do is, you have to inform to the State Pollution Control Board, because of so and so reason, you are not in a position to dispose of the waste in accordance with the rules within 48 hours. I am going to bound to store more than 48 hours. In view of the reasons, therefore, submit for information. If you give that information, then it is not your mistake. Then they will definitely look into the problem, act as confidential operators, then they will sort out the issue and they will see that they will make necessary alternate arrangements. Definitely, confidential operator is going to have alternate arrangements with the neighboring state, the confidential operator. In case if he is having any problem, then he definitely is going to, you will tie up with him, then he will collect and dispose of the waste through confidential. In case if it is there, one method is you inform the state board about the problem. And second thing is, you have to have the storage facility where you can at least control the temperature up to 4 degrees centigrade, where you can store more than 48 hours in that storage room, cold storage provision, so that you can store more than 48 hours with the approval of the state board only. After giving information, you can store more than 48 hours. But you have to have a provision for storage of waste, definitely. And microbiology waste and and all other chemical laboratory waste has to be treated either by sterilization or by disinfection. Sterilization, what is the effectiveness is up to log 6, whereas the disinfection using chemical disinfectants like sodium hypochlorite solution of 1 to 2% and with efficacy about log 4. What is the meaning of log 4 and log 6? Log 6 is nothing but 1 over 10 power 6. Log 4 is nothing but 1 over 10 power 4. Therefore, one spore can survive out of 10,000 spores. Log 6 means 1 out of 10 lakhs. Okay, there is the log 6 efficacy. Which is the best one? Sterilization or disinfection?
Sterilization.
Sterilization is more effective than the chemical disinfection, please.
Sir, can you please explain the log 4 and log 6 again?
Yeah, it is very simple. 1 over 10 power 6. Out of 10 lakhs, one spore may survive. That is log 6 efficacy. We cannot say that we can achieve complete you can kill all the microbes which are there as a part of the waste. Even sterilization cannot give guarantee. Suppose if any spores are there, internal mass of any tissue, it may survive. There is no guarantee that we can kill it also. Therefore, 1 over 10 power, the log 6 is 1 over 10 power 6, whereas log 4 is 1 over 10 power 4. What type of test you conduct for to test the efficacy? Anybody can say? The figures are here. You want to assess the efficacy of sterilization, what test methods can be adopted? Anybody can say, please? If you are microbiologist, you will say.
So there are indicators, I think, chemical indicators.
Yeah. This is the chemical strips. We call it a strip test. This here you can see. I showed here. This is the indicator. It is when you maintain desired temperature and pressure, definitely it changes the color as specified by the supplier. Similarly, the spore test we conduct, and we will keep the spore along with the waste, operate the autoclave, then take out the spore and incubate it. And if there is no change in the color, that indicates that all microbes have been killed. Or if there is a change in the color, that indicates there is activity. That means there is a spores are alive still. Therefore, the treatment of autoclave has not been operated properly. Therefore, you have to repeat the treatment of the batch, that particular batch, which through autoclave is the must. Now, what is the other one is the various political authority in the rules is in the states we call it as State Pollution Control Board. In Andhra Pradesh we got Andhra Pradesh State Pollution Control Board. In Tamil Nadu we got Tamil Nadu State Pollution Control Board. Whereas in UT we call it as Pollution Control Committee. In Andaman we say Andaman Nicobar Pollution Control Committee. Lakshadweep we say Lakshadweep Pollution Control Committee. Therefore, in states we got State Pollution Control Board. They are the prescribed authority. And in UTs, we have got Pollution Control Committee. Remember this, the questions you can expect. Therefore, in state, we have got State Pollution Control Board. In UT, we have got Pollution Control. They are the responsible authorities for enforcement of the rules, regulatory authorities. Then, what is the procedure to get permission from the state board? There are two types of hospitals. One is bedded hospital and another one is non-bedded hospital. All bedded hospitals, they have to obtain authorization. Even non-bedded hospital also has to obtain the authorization. That means permission for generation of waste, collection or handling of biomass in any form. Now, non-bedded hospital, they have to obtain only one time only. Remember, non-bedded hospital, they have to obtain only one time, whereas bedded hospital, they have to go for renewal depending upon the validity they are given. Whereas, as long as there is no change in the activity of the non-bedded hospital, he can take only one time approval. Afterwards, they no need to go for any renewal. That you have to remember. In case if there is any change in the activity of the bedded or non-bedded hospital, then he has to resubmit the application in Form 2. Whereas the state board will give authorized permission in Form 3. Then that is how. In case if objection is there, they have to call for hearing. After hearing, they have to record the reasons for non-grant or cancellation or suspension of authorization or refusal of authorization. They have to record the reasons. Then only they can cancel or suspend or refuse the authorization for the state healthcare facility. Of course, the application has to be the incomplete. If application is complete, then state board has to give within a period of 90 days time, failing which it will be called as deemed authorization. Means within 90 days, if application is complete from the hospital, if application is complete within 90 days, state board has to grant permission. Otherwise, it will be called as deemed authorization. Means you are being permitted by law. They don't need to get any certificate from the state board. This is simple logic. I could show it in the flow chart to understand easily. Therefore, bedded hospitals and non-bedded hospitals, non-bedded hospitals they have to obtain one time, whereas bedded hospitals they have to obtain depending on the validity period. You have to go for renewal. And once the application is submitted in Form 2, the state board will issue the authorized permission in Form 3 within 90 days of submission of your application. Of course, every state should have the state government has to constitute an advisory committee. This advisory committee has to organize once in 6 months, and they have to suggest the measures for management of biometric waste in the respective state constituted by the state government. Similarly, the monitoring also is done through the district level monitoring committee. District level monitoring committee definitely the authorities. DC will be there, who is the chairing the district level monitoring committee. They also can take actions against the healthcare facilities in case of violations. Of course, these are the implementing authorities at the Ministry of Environment Forest. We got at the state level, the national level. Once a year, they review the rules, status of implementation. CPCB can monitor all the army hospitals. Apart from general hospitals, and state government also has to ensure implementation of the compliance to the rules. Of course, then monitoring and implementation of the rules is concerned. I told you, apart from advisory committee at the Ministry of Environment Forest at national level, CPCB, of course, at the national level, apart from the compliance verification by the army hospitals, and state government also had to verify the compliance to the rules. And apart from this, district level monitoring committee is there. They also have got the responsibilities for ensuring compliance to the rules. District level monitoring committee will be chaired by DC, district collector or district magistrate, and other members will be there like district medical officer, representative from SPCB, PCC, public health department, local bodies, and IMA representative and conference operators also will be there, and also of course from NGOs also will be a part of district level monitoring committee. This is very important that annual report has to be submitted in Form 4. Form 1 accident reporting, Form 2 for submitting application for opening authorization, Form 3 state board will issue authorization Form 3, whereas Form 4 you have to submit in annual report in Form 4 to the state to the respective state board. Suppose if you are in UP, you have to submit to the UP State Pollution Control Board. If any healthcare facility is there in Andhra Pradesh, they have to submit the annual report by 30th of June every year in Form 4 to the Andhra Pradesh Pollution Control Board. Okay, that you remember which board and all. Then Form 4 annual report submission by 30th of June every year. Subsequently, state board will compile and they have to submit to CPCB by 31st of July. Now, thereafter, CPCB has to compile and submit to the Ministry of Forest by 31st of August. If you don't submit by the hospital, state boards cannot be able to submit their annual report. If state boards are not in the position to submit the annual report, CPCB will not be able to submit to the ministry by 31st August of every year. But you remember, as a part of healthcare festive, you have to submit all the healthcare the annual report by 30th of June every year. It's a must. If you don't comply to the requirement, that is also violation. All the records has to be maintained for a period of next 5 years. Of course, if any accident is there, that you have to submit in Form 1. And in case if you are not happy with the orders passed by any state government, then you can appeal in Form 5 to the Secretary Environment. This appeal has to be submitted within 30 days of receipt of the order to the Secretary, the Environment of the respective state government, whereas Army Hospital they have to submit to the Secretary Environment and Ministry of Environment Forest. And this apparent authority has to dispose of this application within 90 days. Please remember these figures. How many days that to dispose of this applied authority has to dispose of application within 90 days. And site has to be allocated by the urban local bodies for the purpose of allocation of site should be there for future development of any confesty. That is the responsibility of the local bodies. And in case of any violations, action can be taken by CPCB or State Pollution Control Board or Pollution Control Committee in the UTs under Section 5 and 15 of the EP Act. What is Section 5 is? We can take action for closure or stoppage or regulation of electricity or water supply and closure of permanently the confesty or healthcare facility can be taken care of by Section 5. Very important. Under Section 15, this act has been amended. Earlier, we can take it to the law, through court of law, we can take action against any violators. Now, this has been the curtailed. Now, any criminal action will not be, proceedings will not be taken, but penalty will be levied. Penalties may vary from, monetary penalties will be there, no criminal action will be taken now, and these penalties vary from rupees 1 lakh to 15 lakhs. Therefore, now penalties are more. It's very difficult, of course. Any penalties can be levied only through adjudicating officer appointed by the respective state or ministry. And once if it is examined by adjudicating officer and as per his powers, he will approve how much penalties to be levied on the violators. This is the procedure now. It has been amended under the EP Act also. Now, as far as the Schedule 1 is concerned, the biomedical waste has to be segregated in 4 color-coded categories that we see it. Schedule 2 is nothing but standard for treatment disposal of biomedical waste. Schedule 3 talks about authorities who are responsible for enforcement of the rules. Schedule 4 is the label. Label, what type of label you have to put on the containers or bags of containers used for the purpose of segregation of waste, and what label should be there for transporting biomedical waste that we see now. Now, this is the standard, the type of waste. The all infectious waste, like human nautical waste, animal nautical waste, soil waste, expired medicines, chemical waste, the discarded linen, mattresses, beddings contaminated with blood or body fluids, and microbiology, biotechnology, and other clinical waste. Of course, some categories of waste is there. After pre-treatment, you have to put into yellow color. And like I'm telling you, this waste requires pre-treatment. Like chemical waste, this waste requires pre-treatment, like neutralization. Like human nautical waste, animal nautical waste also cannot be stored more than 48 hours, is it? Therefore, some waste which requires pre-treatment that has to be pre-treated, definitely. I will show you some example how to do it. All plastic waste, infected plastic waste, like they have to be stored in red color coded bag. This waste will be treated by autoclave or microwave or followed by shredding. What is the purpose of shredding? Everybody can say, why you have to go for shredding after treatment of waste by autoclave or microwave? Anybody can say?
It can be recycled, sir.
You can avoid you can go for recycling. You can avoid reuse. You can avoid reuse. Therefore, shredding is a must. And all your The waste waste shops, which includes needles, syringes with fixed needles, needles from needle tip cutter or burners, scalpels, blades, or any other contaminated shops, has to be stored, segregated in one white container, translucent container, which should be puncture-proof, leak-proof, tamper-proof container only. Okay, this waste can be treated by autoclave or dry heat sterilization, followed by shredding. Then this waste can go for recycling activity, or else it can be disposed of by encapsulation also. That I will tell you in next class what is the class encapsulation of. Blue categories of waste: all body implants and glass waste can be stored in blue container. It cannot not required to be a container. It can be a cardboard box also, but it should be puncture proof and leak proof boxes or containers with blue color marking. And this waste can be treated by disinfection, or you can go for using a hypochlorite solution of 1 to 2% hypochlorite solution, or you can use autoclave or microwave for treatment of this waste. Then it can go for disposal. And for treatment of the waste is concerned, you can use hypochlorite solution 1 to 2% only. This you have to remember. 1 to 2% of sodium hydrochloride solution, having 30% residue chlorine for 20 minutes, minimum 20 minutes. You should be able to treat using chemical treatment. This you remember, please. Similarly, we are going to operate the standards. Operators are there like incinerators. The temperature should be minimum. The minimum temperature you have to maintain, and which varies from 800 in primary chamber, whereas in secondary chamber 1050 plus or minus 50. And resident, the efficacy should be able to achieve combustion efficiency 99%, and you have to maintain the complete requirements of emission standards for particulates 50, nitrogen dioxide about 400, HCl cannot be more than 50, dicynfurans it should be 0.1 nanogram toxic equivalent per nanometer cube, and mercury and its compounds cannot be more than 0.05. Through the stack emissions, when you are operating treating the equipment, treating the waste using incinerators, the standards has to be complied, and these are the operating the standards you have to maintain. Similarly, coming to autoclave, autoclave has to be temperature. At what temperature? Anybody can say, please? At what temperature can operate your autoclave?
121 degree.
121 and 15 psi pressure, and not less than 60 in case of gravity flow autoclave. Whereas in case of the vacuum autoclave, the temperature can be 121 degrees centigrade, not less than 15 psi pressure, and not less than 45. You can reduce the time in case of vacuum autoclave. Of course, this is a test we conduct, spore test, for assessing the validity of the efficacy of the autoclave, and other one is routine test, which I told you already. Of course, spore test has to be conducted every batch. Spore is like a strip. We use it for every batch. This spore has to be conducted. Whereas in case of routine test, that you have to conduct for once in a week, and spore test has to be conducted once in a week. Whereas the routine test, like a strip test, you can conduct for every batch. Spore test is a lengthy process, whereas the strip test is a simple process where you can you can assess the efficacy have been achieved or not. Similarly, we can use microwave. Microwave is also the same technology, where here the mode of treatment is using microwaves. Of course, the methodology used for testing the efficacy is bacillus subcutaneous spores using vials or spore tips with at least 1 into 10 power spores per millimeter. Similarly, the deburial is permitted where there is no access to comb festive. Where there are no any comb festives, then in such a case only deburial is permitted. We'll go into deep when I'm going to talk about disposal methods, that I will go in detail. But just to have knowledge, this you can see. Of course, this the deburial method can be allowed where in rural areas where there is no access to comb festives only. And deburial, so the specifications, and below the ground level at least 2 to 5 meters depth should be there. And for every layer of disposal of waste, we have to cover with the soils. And once it is completed, there should be proper fencing, proper closure should be there with the soils. Then it can be disposed of. It can be left as such. Of course, other methods are there like dry heat sterilization. It is the equipment used in Delhi only. Even in Chandigarh, they are not adopted this technology. Only in Delhi, they have 1 or 2 hospitals. Afterwards, it is not famous. And there's a very simple technique where the temperature is maintained for a period of 90 minutes of 185 degrees centigrade, dry heat sterilization. Once cycle is complete, for complete cycle, it takes about let us say it is 30 minutes and 90. 120 minutes, 2 hours it takes for one cycle. Generally, we use for waste shops only. You see, the technology where this lid is a box with the lid is given, or once it is filled, all the shops and needles, then once it is lid is closed, and the plastic polypropylene which is there, it can act as a binding agent when you use dry sterilization. When you keep this box inside this equipment, this lid acts as a binding agent. It becomes a solid mass, then it can be disposed as solid waste only. All the liquid waste has to be complied to the requirements of discharge standards prescribed under the rules. Means the liquid waste before you discharge, it cannot be more than, pH should be within 6.49. Suspended solid cannot be more than 100. Oil and grease cannot be more than 10. BOD cannot be more than 30, and COD cannot be more than 50. And BIOC should be able to comply 90% of survival of fish after 96 hours in 100%. And these are the schedules. Responsible authorities responsible for enforcement of the rules, which includes Ministry of Animal Forest, Central and State Health Ministries, then Ministry of Defense, Central Political Board, State Government or Union Territory Administration, State Political Board in the respective state, Political Control Committees in the respective UTs, urban local bodies are all responsible for enforcement of the rules. And these are the labels which you have to use. There is a biology label for on every color-coded bag you have to use. Whereas when you are handling the cytotoxic waste, then you have to put, in order to differentiate whether this is infectious waste or cytotoxic waste, then you have to put, in case of cytotoxic waste, you have to put this C label, whereas in case of general infectious waste, you have to put biology label. This is the difference between cytotoxic waste management and the general infectious waste, healthcare waste management. For transportation vehicles, the vehicle should have this label. Every vehicle should be carried with this label, which indicates what is the source of waste generation, where the waste is going, how much quantum and all. This record they will be carrying by the vehicle, therefore someone can verify it. And here, the form 1 is for accident reporting, form 2 for application for authorization or obtaining renewal of authorization. Form 3, the state board will give authorization, means permission in form 3, whereas form 4, state healthcare facility or comm facility, they have to submit annual report by 30th of June every year to the state political control board, to the respective state political board in the respective state. Whereas in case of UTs, you have to submit to the respective police control committee. Of course, the form 5, when you are not happy with the orders passed by anybody, then you can appeal in form 5 within 30 days of receipt of the orders. Then that appeal has to be disposed of by the Secretary Environment of the respective government within 90 days from the receipt of the. This is the general pattern how the waste will go. Waste is collected by the conflict operator, segregated waste. Then recyclable waste will be treated by, like red, white, and blue. They can be treated by autoclave, microwave, or hydroclave, or chemical infection. And after treatment, it can go for shredding. Then finally, it can go for recycling activity. Whereas similarly, infectious waste will go for incineration, or you can go for plasma pyrolysis, or another if no method is not there, then one can, no facility is there, then they can dispose of by deburial also. Of course, incineration, when you are treating the incineration, you are going to generate liquid waste, and also ash is generated. Ash can be disposed in landfills, but the wastewater that is generated in the process of scrubbing activity in the air pollution control systems, then that can be treated, then it can be disposed of. Of course, increasing there are some issues and challenges in the monitoring and implementation of rules is increasing the responsibilities of the SPCBs, PCCs, ensuring waste management in healthcare facility, education awareness is required, sanitary landfills are not available. These are the constraints. Emission standards compliance is the challenges. Of course, this is what I want to say, monitoring and quality assessment in healthcare facilities. We got state level advisory committee. Apart from that, we got district level monitoring committee in the state, and the state control board is the regulatory authority. At central level, we got various regulatory authorities, MOF and CC. At central level, CPCB is there, Ministry of Defense is there, Ministry of Health is there. Apart from the state control boards in the state level, we got various regulatory authorities for enforcement of bomb request rules. Of course, I could able to cover up very fastly, and I just want to show some more presentation where you can respond whether you understood properly or not. Any questions, please? Any questions? Any questions, ma'am? Otherwise, I want to just show one questionnaire so that whether you can answer or not, I just want to have a look at it. I just want to upload it. Any questions? Otherwise, I just upload some more thing. Generally, I take 3 to 4 hours to deliver one lecture. Very lengthy talk I give, but within the given time, I should be able to cover everything. I hope so. You understood. Let us hear some small questions within 10 minutes. They can answer or not, which you can expect. I expect that you will answer definitely. Can you see the screen, please?
Yes, sir.
Yeah. Somebody can answer. Boundary waste management rules apply to whom?
D.
Sir, answer
First
D.
D.
Answer D. All persons who
D.
generate correct. Fantastic. Thank you. Who is the occupier in the hospital or healthcare facility? Who is the occupier means generator or the biomedical waste?
D.
D. Sure. Medical paramedical staff. Fantastic. Thank you. Who is the prescribed authority in the state? In the state, who is the prescribed authority for
B.
enforcement of the rules?
Sorry.
Which one?
State pollution control
State
board.
Pollution Control
State,
Board.
in the state, we have got State Pollution Control Board. In the UTs, we have got Pollution
Pollution
Control
Control Committee.
Committee. Yeah,
Committees.
yes.
Committee.
How do you define biomedical waste as per biomedical waste rules?
D again, sir. D.
What is it? Can you read out?
Waste generated from diagnosis or immunization of human beings or animals or research activity or waste categorized
Yeah.
under Schedule 1 of rules.
Thank you. Thank you. How many color coded categories of biomedical waste is there as per
4.
rules?
4.
Option B. 4.
What
B.
are they? What are they? Can you say? What are
Yellow,
they?
red, white.
Red, yellow, blue.
Red, yellow, blue, and white. Yeah.
White.
Name of the suitable equipment used for on-site or intramural transport of biomedical waste. What type of vehicle you can use for within the hospitals?
It's a
C, sir.
closed,
Closed and
trolley.
label wheelbarrow and trolley.
Yeah, wheelbarrow or trolley we can use. Thank you. Biomedical waste such as untreated human and animal analytical waste and infectious waste cannot be stored beyond dash hours.
48 hours.
48
sir.
hours.
48 hours, sir.
Yeah. Suppose if I remove this untreated, it's
So
stored
we
more than.
have to.
No, if I remove this untreated, then what is the meaning? I can store more than 48 hours also.
Oh,
Okay, untreated waste cannot be stored more than 48 hours. Remember that. What is the proper place for segregation of biomedical waste? Which place is the best place for segregation of biomedical waste? Where you have to segregate the waste?
Source of generation.
Source of generation.
C.
Source of
is?
generation.
Answer is?
C.
C.
Yeah, thank you.
C.
What type of biomedical waste requires pre-treatment within the hospitals? Can you please somebody can
Option C. Lab-based
C.
microbiology
C, sir.
and blood sample.
Lab-based microbiological waste, blood samples, and blood bank.
Yeah, tomorrow I'll show you, when I come next time, tomorrow, I'll show you my presentation, how to compare to the rules that you should know, because whatever it may be, for understanding proper rules, I'll show you that the presentation that you have to have a look at. We'll have a quick glance, then I'll cover up the actual topic also. Then, what label you have to use for cytotoxic waste?
C.
C.
That's
C.
C.
I have not drawn C here, that you have to say one. Occupier or generator biomedical waste is required to dispose of general biomedical waste through a common
75 kilometers.
located at what distance?
25 kilometers. Within
75 kilometers.
Within 75 km. What is the answer?
C.
C.
What is the temporary temperature, pressure, and duration to be maintained for treatment of biomedical using vacuum autoclave?
121 degrees, sir.
So
121
121
degree.
PSI and
Pressure?
45 minutes.
15.
And sterilization time?
45 minutes.
Yeah, not less than 45 minutes.
45.
Thank you.
No,
What is the efficacy to be achieved in case of sterilization?
Log
Log
6.
6.
Log
Option
6.
B.
In case of chemical infection, you have to
Log
achieve
4.
log 4. Yes,
Log
thank
4.
you. Remember that words. Up to what time records pertaining to biomedical waste generation and operation treatment equipment is required to be stored by the confidential operator? How many months you have to store the records?
60 months.
60
5
months, sir.
years.
5 years.
60
5
months.
years
sir,
or
5 years.
5 years
5
or
years, sir.
60 months.
60 months.
5 years means 60 months, isn't it? Therefore, 12 months in a year, 5 years means 60 months. I give it in months only. Which form is required to be submitted to the prescribed authority by a hospital
Form 1, sir.
for obtaining authorization? For obtaining authorization.
Oh.
Form 1 is for accident reporting. Form 2 is for obtaining authorization. Form 3, state board will issue permission. Form 4, you have to submit annual report. Form 5 is appeal. Form 5 is for appealing. Okay, remember these things. What is the time period by which authorization under rules to be given by the prescribed authority? Suppose if you have submitted your application form 2, by what day, by how many days state board has to issue authorization?
90 days.
Within 90 days, yes. Within 90 days, state board has to issue authorization in which form? They have to issue in form 3. Whereas you have to, the healthcare facility has to submit their application in form 2. Okay. What is the time limit for submission of annual report? By what time you have to submit your annual report by the hospitals?
By 30th June, B.
June
By
30th.
30th of June every year. What is the
Every
answer?
year, sir. D.
D.
Yeah. Who is the prescribing authority in case of army hospitals?
DGAFMS.
DGFMS. Fantastic. Thank you. Under which provisions action can be taken by against healthcare facility or comp facility for violation of the provisions? In case of violations there, I told you can take action under Section 5 as well as Section 15 of the EP Act. Section 5, what is the Section 5? We can go for closure or we can issue show-cause notice and we can even close the hospitals. We can stop power or water supply and we can stop even electricity also. Under Section 15, there is a penalty provisions is there. The heavy penalties, it starts from rupees 1 lakh to 15 lakhs. Of course, the penalty can be levied on the violators through adjudicating officer. Adjudicating officer can levy penalty on any violations proposed by the state penal board. I see these are some of the questions which you can expect in your exam. I just want to show it. Generally, when you go for giving lecture, I show this one. Before and after, I circulate. I try to get their opinion so that they can easily find out. Easily whether they have understood all rules. Generally, I found they answer very well after my talk only. Generally, otherwise, generally they don't respond properly. That is what I feel. Any questions still you can discuss with me.
Sir, in the final exam, long essay questions will come or objective MCQs questions, sir?
I say okay. Objective question only.
Okay, sir. Thank you, sir.
Still, if you have any questions, you prepared, you go through your syllabus, and tomorrow also we'll try to have some questionnaires before I conclude the session tomorrow. Tomorrow we'll meet at sharply by 4 o'clock, and if any questions, still you can ask me. Don't feel shy. Don't hesitate to ask questions. You are free to talk to me, or you can have my mobile number also. I'll show you tomorrow. You can have my contact details so that if you want to ask me any questions, and still you can ask also. There is no such thing that you cannot ask me. You are free to ask me any time also. Not only now, after close of this the counseling also. If you are having any doubt, you can talk to me. You are most welcome. Okay. If you have no
Thank you, sir.
questions, I can conclude at this stage, please. Thank you all for attending my class. I hope so you have enjoyed
you,
my
sir.
lecture. And in next class, we'll see in other topics, please. Okay. Thank you all.
Okay.
Thank you, sir. Thank you so much.
Thank you, sir.
Thank you, sir. Thank you.
Thank you so much.